Hi, my name is Tori and I am a doctor of physical therapy who specializes in pelvic dysfunction, which means that part of what I treat is bowel dysfunction. One condition that I find I am treating more and more is a form of chronic constipation called slow transit colon or sluggish colon, and I'm starting to think there might be a little bit of spillover or bleeding into constipation dominant irritable bowel syndrome as well. Essentially, this human presents with the following symptoms. 1 is long-standing constipation. 2 is infrequent urges to have a bowel movement or defecate. 3 is laxative dependence, usually to an herbal or stimulant laxative that is associated with painful abdominal bloating or maybe even some fecal leakage depending on how long the person has been using the laxative. 4 is painful abdominal bloating. And 5 is usually with this human when this person tries to increase their fiber or increase their water intake, they just end up with more painful abdominal bloating. It doesn't seem to touch their symptoms. This is a really tough group of symptoms to have, and I wanted to take the time to discuss at least part of the treatment that I've found to be effective for these humans. And that would be weaning off of laxatives that are truly habit forming, that truly cause you to be dependent on them. But before we discuss laxatives, before we discuss laxative dependence, and before we discuss laxative weaning, I want to say out loud that you should not use this method without the supervision of your primary care provider or another trusted physician. This video is meant to be informational and educational, and laxatives can affect other body systems, so it's really important that you're working with somebody that knows what medications you're on, that knows your past medical history, that will be able to guide you in a way that is safe for you. You can read my full medical disclaimer in the description below. Also, I just realized that this thing in the background is in the picture. My fiance and I are currently working on a mosaic, so those are just pieces of glass tile. That's what that is. Okay, so before we break down different kinds of laxatives and how they work and why some are habit forming and some aren't habit forming, you need to have a basic understanding of how your GI system or digestive system works. So if we follow a piece of food as it enters your mouth until it exits your anus as a bowel movement, then that piece of food would start in your mouth where you would chew it, and then it would go into your esophagus, and then it would land in your stomach. Your stomach lives under your left rib cage, and this piece of food would stay in your stomach where it would be chopped and mixed for somewhere in the realm of 2 to 4 hours until your small intestines were ready for it. Then that piece of food would go from stomach into small intestines where it would stay probably for 4 to 6 hours. Your small intestines are where the majority of true absorption of nutrients takes place. Then that piece of food would go from small intestines to large intestines, and then large intestines to rectum, and then rectum to anus, where it would finally exit as a bowel movement. In a healthy colon or in healthy large intestines, that transit time from the time that it enters your large intestines until that food exits as a bowel movement is usually in the realm of 24 to 72 hours. And your large intestines are pretty incredible. They essentially take in somewhere in the realm of 1,000 to 1,500 milliliters of thick liquid, and as that thick liquid goes through your large intestines, there's only about 100 to 150 milliliters of well-formed stool left by the time that that enters your rectum, and that truly is poop, stool, feces, that's your bowel movement. So if we break that down even more, when food enters your stomach, it initiates a reflex called the gastrocolic reflex. And the gastrocolic reflex is in charge of initiating peristalsis. Peristalsis is the name given to the rhythmic contraction that your large intestine makes in order to propel that thick liquid, essentially propel that stool from your large intestine towards your rectum. I've used this example in previous videos, but I think it's the best example. Think about a snake eating a mouse. If you can envision what that mouse looks like as it kind of moves through the snake's body, that's essentially what your large intestines are doing when they propel that stool towards your rectum. That is called peristalsis, and you don't have any control over it because your large intestines aren't a voluntary muscle. They're made of smooth muscle, just like you don't have any control over your heart or your stomach. So, food enters your stomach, the gastrocolic reflex is triggered, and your large intestines initiate peristalsis, aka they rhythmically contract and propel stool towards your rectum for a bowel movement. Now, in a healthy colon, in healthy large intestines, there are a few things that trigger peristalsis. Eating triggers peristalsis, waking up in the morning triggers peristalsis, and exercise tends to trigger peristalsis. With that in mind, let's talk about the different kinds of laxatives. We're gonna put laxatives into two categories in this video. The first category is gonna be habit-forming laxatives. Habit-forming laxatives are going to include stimulant laxatives. Herbal laxatives are a kind of stimulant laxatives. Non-habit-forming laxatives, for the sake of this video, are going to include osmotic laxatives. There are other kinds of laxatives like bulking laxatives, but humans that are usually dealing with chronic constipation, sluggish colon, slow transit colon, even constipation dominant, IBS, don't usually use bulking laxatives because it's a huge increase in fiber essentially, and like I said earlier, that usually makes abdominal bloating and other symptoms worse. Habit-forming laxatives are habit-forming because they cause peristalsis. They initiate that rhythmic contraction for the intestines. They cause the large intestines to contract and propel stool towards the rectum, regardless of whether or not there's actually well-formed stool there, which is why if someone's taking an herbal or stimulant laxative, they might find that their bowel movements are partly formed and also partly watery. Like we said earlier, your large intestine takes in anywhere between 1 liter and 1.5 liters of thick liquid, and if that liquid isn't well formed, well then when you initiate peristalsis, no matter where you are in that process, you're gonna get well-formed stool and you're gonna get liquid. With laxative dependence, over time, the bowel muscles become less and less able to contract with those natural stimuli that we were talking about, like waking up in the morning, exercise, and eating. Eventually, you get to a place where your bowel muscles become entirely reliant upon the laxative in order to contract, in order to have peristalsis, which means complete dependence on the laxative in order to have a bowel movement. These laxatives aren't habit-forming because you actually crave them. They're habit-forming because your large intestine can't contract without them. Like I said earlier, laxatives that fit into this category are stimulant laxatives, which include herbal laxatives. So the big name herbal laxatives are Senna, Cascara, and Frangula Bark. And then the big name stimulant laxatives are Ducolax, which is the same thing as Bisacodyl. If we switch gears and talk about non-habit-forming laxatives, the reason that these laxatives are non-habit-forming is because they don't directly initiate peristalsis, they don't directly cause that rhythmic contraction of the large intestine. Instead, they indirectly stimulate or indirectly trigger peristalsis. While there are different kinds of osmotic laxatives, the mechanism of action, what's happening, is essentially the same. Osmotic laxatives usually have some ingredient in them that's difficult to digest, that will stay in your large intestines throughout the entire process. This ingredient draws water into the intestines, which causes the food/stool that's in your intestines to not only soften, but also to swell. When the food/stool/thick liquid, the stuff in your intestines, starts to swell, it stretches the wall of your intestines. That stretching of the intestinal walls stimulates peristalsis, and then boom, you end up with a bowel movement. So different kinds of osmotic laxatives One is Epsom salt, aka magnesium sulfate. In this case, it's the salt that's poorly absorbed, and it's the salt that draws water into the intestines. We've also got osmotic laxatives, where polyethylene glycol is the main ingredient. The big laxative here that everybody knows is MiraLax. Polyethylene glycol is another ingredient that's difficult to digest that draws water into the intestines. Same thing with milk of magnesia or sweet syrups like lactulose. These all fall under the category of osmotic laxatives and are therefore non-habit forming. So if someone is trying to wean off an herbal or stimulant laxative, one of the most important things that needs to be defined is what is the actual ideal bowel habit. A lot of times I find that people are aiming for arbitrary goals like 1 to 2 bowel movements a day. I have adopted what I consider to be the ideal bowel habit from a wonderful physician-authored book called The Bowel Book. Now, I will say that while this book is incredibly helpful, I don't think it's written in a language that's really friendly to the non-healthcare provider. However, if you are interested in it, I will include a link to it in the description below. So with that being said, the ideal bowel habit essentially includes 7 things. Thing number 1 is the ability to defer the urge to have a bowel movement for at least an hour without any abdominal pain or rectal pain. Thing number 2 would be complete voluntary control over gas and very well-formed stool, not diarrhea. Number 3 would be prompt evacuation of a bowel movement once you sit on the toilet, aka you sit down on the toilet and boom, you can start defecating within a reasonable amount of time. Thing number 4 would be smooth, steady passage of stool or poop as you're having your bowel movement over maybe 1 to 2 minutes or less without pain, bleeding, or any form of prolapse. Thing number 5 would be you feel like you completely emptied your bowels when you get up off of the toilet. Thing 6 is no symptoms of irritation in the perianal skin, which is just a fancy way of saying the skin that lives near and around the rectum in between bowel movements. And the final thing, thing number 7, is no abdominal pain or bloating in between bowel movements. So what I just outlined, that is my goal with my patients when we are working towards the ideal bowel habit, when we are trying to normalize bowel function. We're not aiming to have 1 bowel movement a day or 3 bowel movements a day or 1 bowel movement every other day. We are trying to meet all 7 of those criteria, however that looks, whatever that looks like is okay. Okay, so then how to wean off of habit-forming stimulant laxatives. The goal is to replace frequent stimulant laxative use with less frequent osmotic laxative use. That's goal number 1. And then goal number 2 would be, once we're using osmotic laxatives less frequently, if the person is able to wean off of the osmotic laxatives, then we'll try to wean off of the osmotic laxatives. I do want to pause and say that all humans are different, and some humans that have been using stimulant laxatives for a really long time, whose gut is really dependent on that stimulation for peristalsis, while you are likely to be able to wean off of the stimulant laxative, you might not be able to wean off of the osmotic laxative, and that's okay. It's okay. The goal is that you are in control of your bowels and that your bowels are able to contract without the help of a stimulant laxative. Now, there are other humans that maybe are younger, that have age on their side, that have less comorbidities. Maybe the only real issue for them is their bowels. They don't have a heart condition or some other condition that might play into their overall health. Maybe they've been using stimulant laxatives for less time. A lot of different variables can play in, but that person might actually be able to wean off of stimulant laxatives and then wean off of osmotic laxatives. But like I said, really the goal is that you are in control of your bowels and that your bowels aren't controlling you. So be kind to yourself with this process, be kind to yourself on this journey, and be okay meeting yourself where you are. So with weaning off of laxatives, we have to be slow and steady. Bowels love routine. If you abruptly change up your routine and abruptly try to wean off of stimulant laxatives, all you're gonna get is a lot of abdominal bloating and pain and constipation. So I figured the best way to talk about laxative weaning is to use real life examples. So I'm gonna use 2 clinical examples of humans that I treated, where they started, and how we ended up off of laxatives. I had one human who was presenting with those symptoms that I mentioned in the very beginning of the video, and this person was drinking Senna tea 1 time a day in order to have a bowel movement. So part of our treatment, with the okay from her primary care provider, was to wean off of that Senna tea, to wean off of that stimulant laxative. So here is what we did. So we started for 1 week. She continued to drink that Senna tea 1 time a day. The following week, we changed that to once every other day. The 3rd week, we had her drinking the Senna tea 1 time every 3 days. And when she got down to 1 time every 3 days, we gave her the green light to use an osmotic laxative if she felt like she needed it. We were using MiraLax up to 3 capfuls. So what that looked like is during that week where she was using the Senna tea once every 3 days, on that 3rd day when she was using the tea, if she felt like she needed to evacuate a little bit more, like the tea wasn't enough, she was allowed to use up to 3 capfuls of MiraLax to really get things going for her if she needed it. The following week, we bumped down to the Senna tea once every 4 days and paired it with the 3 capfuls of MiraLax if she needed it. By this time, she no longer was in need of the Senna tea, which was really amazing. We had treated her pelvic floor impairments, and I had her doing a couple of other things, which I will say out loud in just a minute, which made it so that she was able to have bowel movements with just the MiraLax, which was really cool. However, if you were trying this and it wasn't working in that same way, if you were down to the Senna tea once every 4 days paired with the MiraLax, but you still needed these laxatives in order to have a bowel movement, you would just continue with the pattern. Herbal tea once every 5 days with the MiraLax, herbal tea once every 6 days, 7 days, 8 days, on down until you can get your bowels to naturally contract without that stimulant laxative. Another patient that I was treating, another human that I was treating, was taking 8 servings of Ducolax or the Bisacodyl once a week in order to have a bowel movement. So before we could wean down to the same pattern that I was using with the previous person, we had to wean that serving, that 8 Ducolax once a week. We needed to get that down to 1 Ducolax once a week. We also used MiraLax as the osmotic laxative to help with the weaning off of the stimulant laxative, and so our regimen looked a little bit different. We started out that first week, just stick with the 8 servings of Ducolax. The following week, it was try 7 servings of Ducolax paired with up to 3 capfuls of MiraLax, and then 6 servings of Ducolax with up to 3 capfuls once a week the next week, and then 5 servings of Ducolax, up to 3 capfuls of MiraLax once a week the following week, and on down until we could get 1 serving of Ducolax once a week with the 3 capfuls of MiraLax if she needed it. So, having treated other pelvic dysfunction, other pelvic floor dysfunction that this person had, we were able to get down to 1 serving of MiraLax once a week in order to stimulate a good bowel movement. And this person did have some spontaneous return of that peristalsis, of that natural intestinal contractions, which means that this person was having more than just 1 bowel movement per week, which was great. A few things that I did with both of these humans that, in my opinion, was very effective and helpful for them, other than treating the direct pelvic floor impairments that they had. One thing that we did is I taught them self-intestinal massage, and I do have a video on this. I will link it at the end of this video. I'll put a link to it in the description below as well. But essentially, I had them doing self-intestinal massage every morning when they woke up, every night when they went to bed, and then PRN when they needed it. If they were feeling bloated and heavy and uncomfortable, I'd encourage them to take 5 minutes and do some self-intestinal massage. We also had them doing some sort of exercise after every meal. So after their major meals, breakfast, lunch, and dinner, they would take 5, maybe 10 minutes and walk or do a light jog, some form of exercise, because as we talked about, exercise is a natural stimulant of peristalsis. Exercise is a natural way to get those intestines contracting, and I thought that maybe pairing some exercise after meals while weaning off of the laxatives would help with potentially some of that spontaneous regaining of natural peristalsis, help those intestines get back to their baseline. The third and last thing that we did that you can easily do is make sure that they were sitting on the toilet properly when they had a bowel movement. I also made a video about this, how to sit on the toilet properly to poop. I will link that at the end of this video, and I'll also put a link to it in the description below. So for these humans, weaning off of the stimulant habit-forming laxatives, using the intestinal massage, exercising after meals, making sure that they were sitting properly on the toilet, and then also treating whatever pelvic floor dysfunction it is that they were presenting with, worked. It helped. It made it so that they could live a life where they were in control of their bowels instead of their bowels being in control of them. Phew, okay, that is a lot of information, but hopefully helpful information, hopefully directional information. Thank you so much for watching. If you found this video, you might benefit from pelvic physical therapy. If you live in the United States, I will provide a link in the description below for a directory that can help you find a pelvic provider near you. Please feel free to comment any questions in the comment section below. Also, if you have a topic surrounding pelvises that you'd like me to discuss, let me know in the comment section. I'm very, very open to suggestions. If this video was helpful for you, please give it a thumbs up. Don't forget to subscribe to my channel for more content regarding pelvises and pelvic health. If you are watching this in January of 2019, then I am currently celebrating 1,000 subscribers, which is amazing and incredible. And I have created a giveaway to thank my subscribers, but also to make pelvic empowerment better. So I have made a 2-question survey. If you are subscribed to my channel, you can answer the survey questions and enter to win $50. I would really appreciate your feedback. I will provide a link to that survey in the description below as well in case you want to fill it out. Okay, thank you so much again for watching. I really appreciate you, and I hope that you have a wonderful rest of your day. I will see you guys soon. Bye.